On this call, I want to cover natural alternatives for pain relief. Is it possible to get the benefits of non-steroidal anti-inflammatory drugs without the potential side effects that come with those medications? And if you're listening to the call, then you probably know the answer is yes, and that's what we're leading up to. So before we get started, I just want to remind you that the information on this call is for information purposes only. This isn't medical advice for your specific case, because the likelihood is that if you're listening to this in a non-live format, then I don't know your specific case. So take this information and speak with your provider to determine if this is right for you. But I'm excited to cover today's paper because research reveals there are many options for natural anti-inflammatory agents for pain relief. And this paper was published in the journal Surgical Neurology International way back in 2010 by one author named Joseph Maroon. And Joseph Maroon is a neurosurgeon in Pittsburgh, and he's actually the neurosurgeon for the Pittsburgh Steelers. And so, that doesn't make the information more useful, but it's a cool nugget for people who are into NFL football. And so let's jump over to the actual paper. And here we are on the actual paper. And the paper, again, is entitled Natural Anti-Inflammatory Agents for Pain Relief. And this is an open access article. So if you type that title into Google, you can pull this up yourself to read it. And so in the abstract, the authors say the use of both over-the-counter and prescription non-steroidal medications is frequently recommended in a typical neurosurgical practice. But persistent long-term use safety concerns must be considered when prescribing these meds for chronic and degenerative pain conditions. Although non-steroidal medications can be effective, herbs and dietary supplements may offer a safer and often an effective alternative treatment for pain relief, especially for long-term use. And so if you're older than 30, and maybe it might need to be, probably if you're older than 30 and listening to this, then you might remember such brands such as Vioxx, which was a non-steroidal anti-inflammatory drug put out by Merck years ago. And in 2004, Vioxx was pulled off the market because it led to increased clotting and heart attacks and deaths. And so that's not the only one that's been pulled off the market. So there's a history of these medications actually being fatal. And so we want to look for non-medication or natural options that can accomplish the same thing that these drugs do, but without those side effects. And we'd also, one reason NSAIDs are popular is because we know that taking steroid-based medications for pain relief is not a good option long-term, because there are many known side effects of that, which include, if you're taking steroids suppress the immune system, right? That's one of their major anti-inflammatory benefit or mechanisms. But by suppressing the immune system, you increase risk of infection. Steroid medications are also known to promote high blood pressure. They're known to promote mood change, and long-term use can promote stomach ulcers and osteoporosis. They're associated with adrenal issues long-term, and Cushing's disease, which would be, end-stage adrenal damage from too much cortisol. You might gain weight, you might become depressed, you might have impaired wound healing. There's lots of ugly potential side effects with steroid-based drugs. So the non-steroidal drugs were created, but even those have their side effects, such as ulcers and clotting, leading to heart attack and stroke and things like that. So we need natural anti-inflammatories. Are there such things? Well, absolutely. But before we dive into that, I just want to show one figure right here from this paper. And this figure is showing how inflammation starts from a tissue injury perspective. So if your tissue is injured, then one inflammatory pathway that is activated is called the arachidonic acid pathway, which is the omega-6 pathway. And you may have heard of omegas before. The omega fatty acids, omega-6s, omega-3s, those are essential fatty acids. And by essential, we mean the body cannot produce them, so we must consume them so that we have them. While the omega-6s are pro-inflammatory, they start fires. Omega-3s are anti-inflammatory, they put out fires. Well, in this graphic here, you can see arachidonic acid is the parent omega-6, okay? And from arachidonic acid, you can go down the LOX pathway, which leads to leukotrienes, which is one form of inflammation. And then you have the COX pathway, which leads to cyclooxygenase and different inflammatory pathways that way. And so you can see here the NSAIDs are COX-2 inhibitors. Some NSAIDs are COX-2, some are COX-1 and 2 inhibitors. And when you block the COX pathway, you can block inflammation, but you may also block anti-inflammatory molecules from the COX pathway. And that's what the Vioxx and some of those other medications were doing, is they were not only blocking the bad ones, but they were blocking the good ones, which happen to prevent clotting. And so that lack of clotting prevention led to too many clots and deaths. So we want to look at today, and this paper is looking at, are there natural products that can accomplish inhibition of inflammation on COX pathways and LOX pathways and NF-kappa B pathways without increasing risk of death or promoting ulcers or things like that. So there are, and we're going to talk about a group of them. They include omega-3 fatty acids. They include white willow bark, curcumin, resveratrol, green tea extracts, pycnogenol, boswellia, various ones. So we'll get to them today, but we'll start with the omega-3s. We were just talking about omega-6s, which were pro-inflammatory. Well, the omega-3s are anti-inflammatory, and they've been known for years to be significant anti-inflammatory molecules. And the two main ones are called EPA, which stands for eicosapentaenoic acid, and DHA, which is docosahexaenoic acid. Both inhibit the COX pathway. They also inhibit the LOX pathway. Research has shown that they're so effective in coronary artery disease that the American Heart Association even recommends them for prevention of heart disease. So fish oils are the most well-known in the general public of the options we'll talk about today. And all of these things are useful for many reasons. Because this is a spinal surgery journal, they're talking about pain specifically in this paper. So these are all effective for natural pain relief, and that's our focus for today. But also recognize that they all have effectiveness for other things, such as heart disease. Some of them are anti-cancer, some of them prevent neurodegeneration. So dive in deeper if you want to know, if you have a condition other than pain, where these may be useful specifically. So EPA and DHA are very effective. And there was one study that showed that 59% of people who were taking NSAID medications could simply just substitute fish oil instead and get the same benefit. And so that's powerful, and that's important because you can get the same benefit in pain relief. And that study specifically was looking at neck or low back disc pain. If you can substitute out the NSAID medication and use fish oil instead, then that's a big win, because you get the same benefit from the fish oil for the pain relief, but then you get all the other benefits fish oil provides in terms of heart health and vision health and central nervous system health, etc. This paper said the recommended dosage ranges from 1.5 to 5 grams per day. And again, that depends on the person and the case. And so, to get specific for you, we'd have to speak specifically to you. The next option we want to talk about is white willow bark. White willow bark is nature's aspirin, essentially. It comes from the white willow tree, and it's been used for, you know, eons, essentially. Been used from ancient Egypt, Rome, Greece, the Indian civilizations, and it also inhibits COX-1 and 2. And again, the research has shown that its efficacy is comparable to aspirins, and it basically is converted to a molecule similar to aspirin in the body. And because of that, children shouldn't take white willow bark because, like aspirin, it might produce Ray's syndrome. And patients with ulcers, poorly controlled diabetes, liver or kidney disorders also should avoid white willow bark. But those who aren't contraindicated, the research suggests 240 milligrams per day as the typical dose. Curcumin. Curcumin comes from turmeric. I'm sure many of you out there are familiar with curcumin and turmeric because it's been pretty sexy in the natural health world now for a couple of years. And curcumin and turmeric are from the ginger family. And curcumin is known as a powerful antioxidant, anti-inflammatory, anti-cancer compound. And it accomplishes its goals or its effects by blocking both COX-1 and 2, but also by blocking NF-kappa B. And if you've been around these calls for very long, then we've covered NF-kappa B in other episodes, and NF-kappa B is basically the foundation, the genetic transcription agent of inflammation. So when NF-kappa B is activated, the body is producing pro-inflammatory molecules such as tumor necrosis factor alpha or TNF alpha, interleukin 1 beta, IL-6. And we've covered these in other videos and calls, because when someone is inflamed, those are the things we want to block. We want to block those cytokines, but we also, if we could go a step lower, if we can block NF-kappa B at the foundation, then we're really snuffing out inflammation. And so curcumin is shown to do that. And, doses ranging from 400 to 600 milligrams 3 times a day are typical. There is evidence in extreme cases where ulcers have occurred at very high doses. The very high dose, the definition of very high dose was not given in this paper, but most people aren't going to come anywhere close to that level of dose. Curcumin and then resveratrol, which we'll talk about in a little bit. Resveratrol also blocks NF-kappa B. And we've talked about before that curcumin and resveratrol synergistically slam NF-kappa B down even further. So if you can take the two together, you're likely to get an even greater result in pain relief than if you took one or the other individually. Green tea. Green tea is a natural pain reliever. Specifically, the EGCG in green tea. The EGCG is the catechin component of green tea that inhibits the inflammatory cytokines, protects your collagen so that your joints and cartilage don't degenerate as fast. It's also got anti-cancer properties. It is cardioprotective, and typical doses are 300 to 400 milligrams. And you can get that, in a capsule, or if you want to do it like Asian countries do, they drink 3 to 4 cups of green tea a day. One thing to be aware of is if you are somebody with low iron and you're trying to raise your iron levels, green tea is a strong iron chelator, so that would work against you. If you have low iron, drinking 3 to 4 cups of green tea a day will probably dig your iron hole even deeper, so that might not be the solution for you. Pycnogenol. Pycnogenol comes from pine bark, and this has been used for over 2,000 years for wound healing, treating scurvy, healing ulcers, reducing cardiovascular inflammation. And specific to pain and inflammation, it inhibits TNF-alpha and NF-kappa B. It statistically significantly inhibits matrix metalloproteinase 9, or MMP9. MMP9 destroys connective tissue. So anywhere you're breaking down joints and cartilage and other connective tissues, MMP9 is likely to be elevated. So this pine bark extract will help not only by squashing NF-kappa B like we've talked about with some of these others, but this one specifically inhibits MMP9 as well. Studies have shown that it works as an antioxidant 50 to 100 times more potent than vitamin E, and it helps recycle vitamin C and E so that their antioxidant benefits are prolonged. It's known to reduce blood pressure and reduce risk of clotting. 100 to 200 milligrams per day is the standard dose. And one note of caution here is if you're on immune suppressants or you're on steroid drugs, which are immune suppressants, you should not take pine bark extract, because pine bark extract actually improves the immune system or stimulates it. And so if you're taking a drug to suppress it, stimulating it might be, working against the goals of your prescriber. So make sure you speak with them before adding pine bark extract to your regimen. Boswellia serrata is also known as frankincense. And Boswellia is another one that's been used for many, many years in the Middle East. It's anti-inflammatory, it's anti-arthritic, it's a pain reliever. It inhibits the LOX pathway. And this substance has been used in the treatment of degenerative and inflammatory joint disorders. It reduces total white blood cell count and leukocyte elastase and rheumatoid arthritis. So not only, joint pain from a degenerative standpoint, but even rheumatoid arthritis, which is an autoimmune standpoint. In a case of knee pain, in a study looking at knee pain, taking the Boswellia for 8 weeks, 3 times a day at a dose of 333 milligrams, led to statistically significant improvement in the knee pain or reduction in the knee pain symptoms. A combination of Boswellia and curcumin showed superior efficacy and tolerability compared with diclofenac, which is an NSAID medication for treating osteoarthritis or degenerative joint disease. So Boswellia and curcumin can be combined. And like we said a moment ago, curcumin and resveratrol can be combined. So, hey, maybe if you add the 3 together, you get triple whammy. When you're looking for a Boswellia product, you're looking for one that's 30 to 40% boswellic acid. And you can take 300 to 500 milligrams 2 to 3 times a day is the standard dose. There may be GI discomfort with that in some people. Resveratrol is Japanese knotweed, and more commonly for our alcohol-loving population, red wine. Okay, resveratrol is found in the skin of red wine grapes, and the skins are where it's believed to be most concentrated. Resveratrol is anti-cancer, anti-inflammatory, antioxidant, DNA protective. So it's got lots of benefits. So again, people who love wine like to say, well, like to use resveratrol as a justification for their habit. But in reality, in a recent seminar that I was at, Dr. Mark Houston, who is, maybe the top functional cardiologist in the US, he talked about resveratrol and that justification. And he said for men, really that means you can use that justification for 6 ounces a night in men of red wine and 3 ounces a night in women. So not enough justification to get you the amount that you want. But that's what he said in terms of using it for that purpose, using red wine for that purpose. Resveratrol is a potent and specific inhibitor of TNF-alpha and IL-1 beta induced NF-kappa B activation. So again, knocks it out at the source, blocking NF-kappa B. It also suppresses the COX-2 pathway. So 50 to 500 milligrams per day of resveratrol. Again, that's a broad range, and the specific dose for you depends on your specific case. Cat's claw, or Uncaria tomentosa. This is an herb from Peru that contains many polyphenols, alkaloids, and sterols that have antioxidant, anti-inflammatory properties. It blocks NF-kappa B. It directly inhibits TNF-alpha up to 85%. So that's a big one. If you know TNF-alpha is a key driver of your inflammation in your case, then cat's claw specifically blocks that. So cat's claw might be your choice. Cat's claw also specifically inhibits inducible nitric oxide synthase, which is a pro-oxidant or rust driver. And that can be damaging to vessels, to nerves, to tissues of all sorts. So cat's claw can be very effective for those two things. Like the green tea, cat's claw can be consumed as a tea or as a capsule. From a tea perspective, 1,000 milligram root bark and 8 ounces of water is how you want to do it. Or if you take it as a capsule, it'd be 20 to 60 milligrams per day. And then the last thing we want to discuss here as a natural anti-inflammatory is capsaicin from chili peppers. Capsaicin is a pain reliever by producing highly selective anesthesia to capsaicin-sensitive nociceptive nerve endings. Okay, well, what the heck is that? All right, when you have pain, that pain is carried to the brain by nociceptive C fibers. Okay, so nociceptive is a nerdy term for basically pain. And so the pain nerves in our body carry pain to the brain. So if we can inhibit those pain nerves, we can inhibit those pain signals, right? So capsaicin does that. Capsaicin causes degeneration of capsaicin-sensitive nerve endings, which can produce significant and long-lasting increases in nociceptive thresholds, or basically significant and long-lasting pain tolerance. And so capsaicin or from chili peppers can be useful. It can also burn the flesh. So if you put it directly on the flesh, if you've ever had a chili pepper brush up against your skin, it may have burned or caused some redness or irritation to the skin. So you have to be careful if you have experienced that. But at the same time, there are topical capsaicin formulations, and they are used to treat post-herpetic neuralgias. So think about capsaicin if you have chronic pain. And so that's our list. It's quite a list, and these things can be and often are very effective and are used most effectively with a doctor who understands your case and the specific inflammatory pathways that are involved in your case. So if you are working with a practitioner to relieve pain, and if you're on NSAIDs and or steroid medications, it'd be worthwhile to print off this paper, give it to your prescriber, and discuss with them whether natural options that we covered today could be used in your case. Because even if you can't completely get off medication, if you can decrease the dose that you're on, that's a win.